Today, we'll talk about one of the most commonly prescribed medications for type 2 diabetes, metformin. For your convenience, the video is divided into navigation blocks so you can jump to the section you need, skipping any uninteresting parts. My goal is to save you time and provide reliable information about metformin from a legal perspective in USA, specifically FDA. We'll examine this complex medication from different angles to understand its strengths and hidden dangers. As a conscientious author, I'm obligated to include a few disclaimers before the main section. Many people over 40 take metformin daily, but surprisingly few actually understand the official instructions, how the drug works, and what warnings are most important when taking a complex drug like metformin in our country. The goal of this video is to explain the official information in calm, clear, and everyday language. This video is designed to help you or your loved ones feel more confident when talking to your doctor or pharmacist. This video is not medical advice. I'm going to explain in detail all the nuances of using metformin. If you watch to the end, you'll understand what metformin is used for, how it works in the body, common side effects, rare problems to be aware of, and questions you can ask your doctor. Let's get started.
Understanding what this medication is helps you grasp why it is often the first line of defense against high blood sugar. Metformin belongs to a class of drugs called biguanides and is primarily used to treat type 2 diabetes mellitus. Please note that the information in this video is specifically prepared for audiences in the USA and adheres to current labeling standards authorized by the FDA. It is typically prescribed to help control blood sugar levels when diet and exercise alone are. Unlike some other diabetes medications, metformin does not increase insulin production, but rather helps your body use its own insulin more effectively.
Knowing how this drug functions in your body can explain why it is effective without causing weight gain. Metformin works through three main mechanisms to lower blood glucose levels. First, it decreases the amount of glucose produced by the liver. Second, it decreases the amount of glucose your body absorbs from food through your intestines. Finally, it improves insulin sensitivity, helping your muscle cells remove sugar from the blood and use it for energy. For those interested in understanding insulin resistance and metabolic health more deeply, channels like Pediatric MD often provide detailed breakdowns on these physiological processes.
Recognizing the different shapes and strengths of your medication ensures you are taking the correct prescription. In the US market, metformin is available in both immediate release and extended release formulations. Common tablet strengths include 500 milligrams, 850 milligrams, and 1000 milligrams. There is also a liquid oral solution available for patients who have difficulty swallowing pills. It is crucial to check your prescription label to confirm whether you have the standard version or the extended release version, often denoted as ER or XR.
Distinguishing between these two forms is vital because they are taken differently and affect your stomach differently. Immediate release tablets are typically taken multiple times a day, usually with meals to reduce stomach upset. Extended release tablets are designed to release the medication slowly over time and are usually taken once daily, often with the evening meal. You should never crush, chew, or break an extended release tablet, as this ruins the slow release mechanism and can lead to an overdose of the drug entering your system all at once.
Starting slowly with this medication is the best strategy to avoid uncomfortable digestive problems. Doctors in the USA typically initiate metformin at a low dose, such as 500 milligrams once daily, and gradually increase it over several weeks. This process, known as titration, allows your digestive system to adapt to the medication. Following this schedule strictly is important. Jumping to a high dose too quickly is the most common cause of severe nausea and diarrhea in new users.
Taking your medication at the right time significantly reduces the chance of side effects. Standard pharmacy practice recommends taking metformin with meals, not on an empty stomach. Food acts as a buffer that helps mitigate the gastrointestinal irritation common with biguanides. If you are prescribed the extended release version once a day, taking it consistently with your evening meal helps maintain steady drug levels in your body overnight.
Knowing exactly what to do when you forget a pill prevents accidental double dosing. If you miss a dose of metformin, take it as soon as you remember, provided it is with food. However, If it is already time for your next scheduled dose, skip the missed dose entirely and continue with your regular schedule. Never take 2 doses at the same time to make up for a missed one, as this increases the risk of side effects and lactic acidosis.
Being aware that stomach issues are the most frequent complaint helps you stay calm if they occur. The most common side effects reported to the FDA involve the digestive tract, including diarrhea, nausea, vomiting, stomach pain, and gas. These symptoms are usually temporary and tend to subside after the first few weeks of treatment. If these symptoms persist beyond the initial adjustment period, it is important to consult your healthcare provider rather than simply stopping the medication.
Applying practical tips can make the adjustment period much more tolerable. To manage nausea or diarrhea, ensure you are taking the medication in the middle of a meal rather than before or after. Staying well hydrated is also essential if you experience loose stools. Some patients find that switching to the extended-release formulation helps reduce these digestive issues if the immediate-release version is too difficult to tolerate.
Understanding this rare but serious risk is mandatory because it carries an FDA-boxed warning. Lactic acidosis is a medical emergency where lactic acid builds up in the bloodstream faster than it can be removed. While extremely rare in healthy patients, the risk increases if you have severe kidney problems, liver damage, or heart failure. Symptoms include deep and rapid breathing, severe muscle pain, cold skin, and overwhelming fatigue. If you experience these, seek emergency medical attention immediately.
Your kidneys play a critical role in clearing this drug from your system, making regular testing necessary. Because metformin is excreted unchanged by the kidneys, it can accumulate to dangerous levels if kidney function is poor. Your doctor will monitor your eGFR, estimated glomerular filtration rate, before starting therapy and periodically thereafter. Generally, metformin is contraindicated in patients with an eGFR below 30 milliliters per minute, and caution is advised for levels between 30 and 45.
Since the liver clears lactate from the blood, liver health is directly tied to the safety of this medication. Patients with liver disease generally should not use metformin due to the increased risk of lactic acidosis. Your healthcare provider may check your liver enzymes periodically to ensure it is safe for you to continue therapy. While metformin itself is not typically toxic to the liver, a compromised liver cannot handle the metabolic byproducts effectively. Long-term use of this medication can silently deplete essential nutrients, requiring you to be vigilant. Metformin can interfere with the absorption of vitamin B12 in the small intestine, potentially leading to anemia or neuropathy after several years of use. It is recommended to have your vitamin B12 levels checked every 1 to 2 years. For further learning on how nutritional deficiencies impact overall health, channels like Eric Berg, DC, or Peter Attia, MD, often discuss the importance of monitoring micronutrients during chronic medication use.
While this drug rarely causes low blood sugar on its own, the risk changes when combined with other treatments. Metformin does not stimulate insulin secretion, so it does not typically cause hypoglycemia when used as a single agent. However, if you take it alongside insulin or sulfonylureas, your blood sugar can drop too low. You should know the signs of low blood sugar: shaking, sweating, and confusion, and keep a source of fast-acting glucose nearby if you are on multiple diabetes medications. Consuming alcohol while on this medication changes how your body manages safety risks. Alcohol potentiates the effect of metformin on lactate metabolism, significantly increasing the risk of lactic acidosis. This is particularly true for binge drinking or chronic heavy drinking. It is standard medical advice to limit alcohol intake and avoid drinking on an empty stomach while being treated with metformin.
Medical imaging procedures require a specific pause in your medication routine to protect your kidneys. If you need an X-ray or CT scan involving the injection of iodinated contrast dye, the FDA recommends temporarily stopping metformin at the time of the procedure. You generally should not restart the medication for 48 hours afterward, and only after renal function has been reevaluated and confirmed to be stable.
Checking for conflicts with other prescriptions prevents unexpected side effects. Cationic drugs, such as certain heart and stomach medications, can compete with metformin for elimination in the kidneys,
raising metformin levels in the blood. Additionally, diuretics, water pills, and corticosteroids can raise blood sugar, potentially reducing the effectiveness of your diabetes treatment. Always provide your full medication list to your pharmacist to screen for these interactions.
Unlike many diabetes treatments that cause weight gain, this medication has a neutral or beneficial effect on weight. Metformin is often associated with weight stability or modest weight loss, which is advantageous for type 2 diabetes management. It is not approved as a weight loss drug by the FDA, but this side effect is widely recognized as a clinical benefit for overweight patients struggling with insulin resistance.
Managing blood sugar during pregnancy is critical, and the safety of this drug is a common question. While insulin is traditionally the preferred treatment for gestational diabetes in the USA, metformin is sometimes used when insulin is not a viable option. It crosses the placenta and enters breast milk. Decisions regarding use during pregnancy or breastfeeding should be made strictly under the guidance of an obstetrician or endocrinologist.
Older adults require extra caution due to natural changes in organ function. As we age, kidney function naturally declines, often without obvious symptoms. Because of this, doctors in the U.S. frequently prescribe lower starting doses for elderly patients and monitor renal function more frequently. The goal is to achieve blood sugar control without risking toxic accumulation of the drug in the body. Knowing the approved age limits helps parents understand treatment options for children. The FDA has approved metformin for use in children aged 10 years and older with type 2 diabetes. It is generally not recommended for younger children due to a lack of safety data. The dosing and titration strategies for adolescents are similar to those for adults, prioritizing gastrointestinal tolerance. Recognizing who should absolutely not take this drug prevents life-threatening complications. Metformin is strictly contraindicated for patients with severe renal impairment, eGFR less than 30, and those with acute or chronic metabolic acidosis, including diabetic ketoacidosis. It should also be avoided in patients with hypersensitivity to the drug or those in a state of tissue hypoxia, such as during a severe infection or heart failure flare-up.
Sometimes doctors prescribe this medication for conditions other than diabetes, based on clinical judgment. In the United States, metformin is frequently used off-label for polycystic ovary syndrome, PCOS, to help regulate ovulation and manage insulin resistance. While this use is common and supported by medical literature, it is important to note that it is not technically an FDA-approved indication on the label.
Proper storage ensures the medication remains effective until the expiration date. Store metformin tablets at room temperature, away from light and moisture. A bathroom cabinet is often too humid. Keep the bottle tightly closed and out of reach of children. If you have expired or unused medication, do not flush it down the toilet. Instead, use a drug take-back program available at many local U.S. pharmacies. Reviewing a daily mental checklist helps you maintain a safe routine. 1. Did I take my dose with a meal? 2. Have I drunk enough water today? 3. Do I have any signs of unusual muscle pain or difficulty breathing? 4. Do I have any upcoming medical procedures with contrast dye? Integrating these questions into your routine minimizes risks and maximizes the drug's benefits.
To wrap up, knowing when to act is just as important as taking the pill. Continue taking metformin as prescribed to protect your long-term health from the damages of high blood sugar. However, contact your clinician promptly if you experience persistent diarrhea, symptoms of dehydration, or signs of lactic acidosis like deep breathing and cold skin. Remember that this video was not created by a professional doctor, and nothing said here is medical advice. Please take care of your health. I wish you luck and freedom.